Welcome to the Worldwide Doula podcast. I'm Berry, I'm a registered nurse and birth doula, and each week I'm joined by a new guest speaker to talk about all things pregnancy, birth, babies, and parenthood. So it's time to sit back and relax as we get into some juicy topics. Hey everyone, welcome back to the Worldwide Doula podcast. This morning I'm joined by an amazing acupuncturist and nutritionist, Hanna Evans. Hanna lives in the UK. She specializes in women's health, focusing on areas such as helping women prepare for pregnancy, fertility support, irregular periods, ovulation, polycystic ovary syndrome, also known as PCOS, endometriosis, and supporting women before and during IVF. Gosh, that is a lot to get your head around. She also helps with treating symptoms like morning sickness, aches and pains during pregnancy, turning the baby from breech to natural, and treating pregnancy and postpartum related depression and anxiety. Welcome to the podcast, Hanna. How are you this morning?
Great, lovely to see you. Thank you for interviewing me today.
Thanks for coming on. I'm so excited for this. Do you want to start by telling us about yourself and how you got into acupuncture?
Well, short story is that I used to be a journalist myself and got burnout in the 90s. And I found that acupuncture was the thing that really helped me to recover from the kind of headaches that I had at the time, which nothing else seemed to help. And so that gave me an insight into just what acupuncture can do. A short while later, I decided to train in it. It was a kind of a 4-year, well, 3.5 to 4 year training at the time. And I haven't looked back since. I've been practicing for the last nearly 19 years now. It never ceases to surprise me. Every patient is different. And even over all of those years, it can still take my breath away. And I think that's what keeps me going with it. There's something magical about it. Magical
Definitely.
about just how effective it is. Not magical in the sense that it's a mystery, but just how people respond to it.
Yeah, it is so powerful. The number of treatments that I've gotten, and I've just, one needle can just do so much. And it's really understanding the body at a different level. Do you want to tell us what exactly acupuncture is and how does it work?
That is such a huge question. I think you only have to do a little bit of superficial Googling to see actually how much research there is behind acupuncture and all of the various ways that it works. For me, I always laugh and say that basically I'm an electrician. I once met an electrician in Brighton, which is a town near here, and he said, well, it makes sense to me. He said, if you put something metal into an electric circuit and turn the needle one way or the other, he said, you can affect the polarity and you can affect how that electricity runs around a system. And I think for me, that's the way you need to think about acupuncture. So we work on, there's about 370 main acupuncture points, and they are mapped out along this kind of grid, which roughly follows the lines of connective tissue throughout the body. And when we are finding an acupuncture point, we're trained to feel for little depressions and little gaps. And it's in those gaps where we're able to put the needle. So ways to kind of send more information around the whole system and up to the brain. And these points are little gateways into it where we can affect quite large areas of muscle. And also send messages up to the brain to switch off pain or switching people out of fight and flight. And of course, when you lower cortisol and you get people breathing more deeply and more slowly, you're automatically reducing pain, you're automatically helping hormones, you're basically getting the body to fix and repair.
All the important
It's hard
things.
to put it in a nutshell.
It's one of those ones that maybe you just kind of have to go and experience it for yourself to really realize the benefits and how amazing it can be for you and what it can do for you. There are so many misconceptions and common myths about acupuncture. And one of them is, oh, it's sore. You're getting needles stuck into you. Why would you go and do that voluntarily? And yeah, it can be sore if you're like really tense in a certain area. But most of the time it's just a little pinch. What are some other misconceptions that you hear about?
I don't know if it's a misconception, but some people have a certain level of fear and phobia about needles. And those people with real phobias won't necessarily come for acupuncture unless they're really desperate. But I suppose people's experience of needles is from dentistry usually. Acupuncture is very different because we use very, very thin guide tubes. So by just putting pressure on the skin with the guide tube, tapping the needle in, there shouldn't be any sense that the needle's in at all. Most of my patients, they're quite surprised that it doesn't hurt.
Yeah.
It will have what the Chinese call de qi or sensation.
Mm-hmm.
A bit like if you've got a sore spot and you put pressure on it, it can kind of feel good.
Yeah.
The body knows when something good is happening and it feels like a release rather than a tightening.
So how does acupuncture relieve common symptoms of like PMS and like period pain?
Often women with PMS probably have slightly less progesterone to estrogen that particular cycle. And often it's because of progesterone steal. Because the body uses the same ingredients to make cortisol as it does to make pathway towards progesterone. If a woman is particularly stressed in any particular month, or definitely over a series of months, then the body will always favor survival and making the stress hormones over making the sex hormones.
Yeah.
So by getting her more relaxed over a few sessions with acupuncture, you making sure that she has more magnesium and B6 in her diet, maybe giving her the herb Agnus castus, you can make sure that by the next month she's making the balance between estrogen and progesterone is better. And that normally sorts out PMS.
So you kind of balance the hormones a little bit, and that's how you would treat that.
Yeah, because I'm an acupuncturist and a nutritionist, I'll tend to use a combination of herbs and dietary support. Also, talking to women about stress reduction, getting them to exercise, but not over exercise.
Yeah.
Talking to them about their work-life balance, going to bed earlier, and doing acupuncture, which switches them out of fight and flight. That's the kind of thing that we would do. So over a few sessions and maybe a cycle or two, they'll notice that they no longer have PMS, or it's maybe only the day before rather than 2 weeks before or a week before. So they just feel like they're able to cope better.
Yeah. It's so interesting. We start having our periods and we automatically feel like PMS is something that we should have. And that's just something that's like every woman has, everyone, gets pain and they lie in bed for 2 days during their period at least. And they eat lots of chocolate and they eat lots of this not good stuff for you, just like cravings. And it's actually not normal to get really bad period pain or really bad PMS. It's a sign that something might be off. A lot of women are finding out about conditions like endometriosis, fibroids, PCOS. After it's a little bit too late, they might have to have surgery for them to actually find out they have it. And I think we're getting to realize that it's happening earlier and earlier. A lot of women or young ladies are starting their periods and they're having really bad period pain, and they just think that that's completely normal. So do you treat endometriosis and PCOS and fibroids a similar way, or is there a different way that you treat that with acupuncture?
No, they're all very different. I would look at them differently, but they're all symptoms of hormone imbalance, although there's obviously genetic propensity to some of those conditions. Because acupuncture, we're looking at the person as a whole, we'd also ask about family history as well. But just going back to what you were saying, I think what can happen if young girls have period pain, or they have very heavy periods, or they have teenage acne, a very simple solution for that can be that those women are put on the pill.
Yeah, exactly.
And of course, when you are young and you're suffering like that, you are going to take that option. In your later teens, you also might need the pill for contraception because your key concern at that age is that you don't want to get pregnant, quite rightly. But sometimes when women then come off the pill when they want to have children, they realize that actually the pill was helping them with symptoms, but it wasn't getting to the root of the problem.
Yeah.
And sometimes, especially with polycystic ovaries, it can be difficult to get your period back. Because that signal between the brain and the ovaries gets blocked by insulin resistance around the ovaries. So polycystic ovaries is a metabolic syndrome as well. So lots of women with polycystic ovaries in their 30s trying to get pregnant, trying to get their periods back. One of the ways to treat that again is to help them with anxiety, get them more relaxed, make sure they're not over exercising, make sure they're not under exercising, and definitely changing their diet. Even the girls who are not overweight, it's just like getting them off carbohydrates because they are genetically very, very sensitive to carbs.
Okay. So and they tend to put weight on more easily, or?
Some of them do, but there's a whole category of women who just have a lot of localized insulin resistance. And probably there's also a genetic susceptibility to high stress levels, which also creates insulin sensitivity. So with the acupuncture with PCOS, you're working locally over the ovaries to get them to be more receptive.
Yeah.
To the chemicals that are coming from the brain to the ovaries and trying to get through. So you work a lot leading up to ovulation and locally at ovulation, but also working very strongly to get cortisol levels down throughout the month. Again, so that the signals get through. And girls with PCOS have to exercise more than other women as well, because again, it helps with the insulin resistance. But also you just have to make sure that there's differentiation, because there's also women with hypothalamic amenorrhea that can sometimes be confused. So those women, you want to get them to not exercise and to sleep more, to do less. They're often very type A personalities doing too much. So there's a lot of coaching that goes on with working with women's health. We spend a lot of time with people, maybe more so than other medical professionals get a chance to do. We've got an advantage that way. I've got a chance to take a long history at the beginning, and I'll ask them about everything, about their relationships, ask them if there's been any emotional trauma. I mean, we'll look into everything together because it all forms part of a picture.
It's amazing to be able to have that holistic view and holistically treat women rather than just being like, oh yeah, cool, you're here for this issue, let's just do the acupuncture side and then you go to someone else for the rest. That's not what I treat. But yeah, having the nutrition side, I bet that would be so helpful.
Women coming to you with endometriosis or fibroids have already got their medical diagnosis, so they're being supported by their medical professionals already. But I suppose that we get a chance to do all of the other things. So I found that the nutritional training was really important for women with PCOS or fertility issues or with endometriosis, because for them to pay to see me and then pay to see someone else, or not even the payment, but just the time and the stress of going to multiple practitioners. And also if somebody is wanting to fix something quickly because they're wanting to get pregnant, you want to get the information in there straight away and get them to change their diet so that over 3 to 6 cycles, usually, that you're working with them, you can make changes as quickly as possible.
I just wanted to say what you said about the pill, the story of my life. I remember I went on the pill because I started getting acne and I think I just started my period and I was about 13 years old and the doctor was like, great, cool. Here's the pill, no real other information about it. Like just take it at the same time every day, blah, blah, blah. And then when I came off it, I didn't have my period for like 6 months, more than that, actually 7 months. And still now, like I've probably only just gotten it back. I got really terrible adult acne after coming off the pill. My hormones have been all over the place. Yeah, it's been a nightmare. I've been talking to all my female friends like, oh my gosh, are you having this experience too? And they all said, oh, I never went on the pill. Or like, oh yeah, I had that really bad experience after I came off the pill and my hormones didn't stabilize for years. I had a lot of trouble conceiving after coming off the pill because my hormones were so irregular and my body was just a mess. And we don't get told about this stuff. When we get put on the pill, the doctors just like tell you what you should do and not really any side effects. Or maybe they talk about side effects like weight gain or this pill because it has more estrogen than progesterone or yada, 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 it might have X effect. But they don't really tell you about the long-term effects. And there's really not that many studies out there because the contraception pill industry is so big. And
Oh.
I think that they don't want that stuff coming out. Yeah, I think that there should be more information out there about the pill because it's just, yeah.
I also wonder whether we would actually take that in if
Mm,
we told it at that age, because we're so
yeah.
horrified that we might bleed in a geography class, or so terrified that we might get pregnant when we don't want to.
Mm.
There must be some way for them to sow a seed.
Maybe just like you
Probably.
should be reviewed every couple of years for this, or,
Oh, yeah.
have a break. You should be on it for 1 year and then have a break of X amount of months. I mean, it does depend on your maturity at the time, what you're going on it for. And yeah, the priorities are very different. I have to say, that's very true.
I think what I notice, and I haven't looked at the research on it, and this is just what I notice, is that I just wonder whether polycystic ovaries, or a tendency to be polycystic, even if you don't have the full syndrome, I wonder whether it's much more prevalent now in your age group or that age group, because I don't remember my friends and I having polycystic ovaries, but I see that it is an extremely common
Now,
situation. Yeah, I do notice that more girls now are being offered alternatives like the Marina coil. There are some changes in how things are doing, but I think podcasts like yours are great for flagging up the fact that you can do so much. Even if you're on the pill, you can actually be doing a lot of work on your gut, a lot of work on estrogen metabolism, knowing which foods help you clear excess estrogen from your system and also excess testosterone. In fact, it's one of my patients at the moment. It's a typical example. She came off the pill, no period. So I've helped her get her period back, but she was also realizing that she probably did have a polycystic tendency because she was getting slight excess hair, she was getting spots, and she was losing hair up here. Again, with diet and acupuncture, we were able to balance that out for her. And now she actually is. Oh no, she wasn't on the pill. Now she's just come off the pill, and we're trying to get her ready to get pregnant now. So in other words, you can be on the pill or thinking about coming it off, and you can see a nutritionist or an acupuncturist or a herbalist, naturopath, and you can start working on those things so that you're prepared for when you do come off and it's less of a shock for your body.
I think it was a bit of a shock for my body when I came off. That's very true. And I did see an acupuncturist in Indonesia about it. This was like when I was thinking, okay, it's hit 6 months. I haven't had my period yet. What am I going to do? Let's try acupuncture. I had an acupuncture treatment, which was good. And then 1 month later, I got my period back, first period. So let's get back on track. Gosh, we've gone a little bit off track. That's all right. I would love to hear some success stories of how acupuncture has helped some of your patients with endometriosis or PCOS.
Oh, well, I've got a lot. This weekend, actually, I had a very typical email from a patient saying I worked on her immune system and also worked on getting her periods back regularly when she came off the pill. So this is another good example. She found out that she had a very low AMH and she's nearly 40. So she was kind of fast tracked to do IVF, had eggs collected, had them genetically tested, did one round and it didn't work. And we were just getting her ready for a second round. And she's just emailed me this weekend to say she can't believe it, but she's actually pregnant.
That's so amazing.
Actually conceived naturally. So that's fantastic. And luckily, she's still got some eggs put away. So she's got some there for baby number two. So hopefully that pregnancy will continue. So that's just one example. And I've got another patient at the moment whose fibroid has reduced from 11 centimeters to 7 centimeters.
Wow.
A lot of my patients will see me because they've got hypothalamic amenorrhea or PCOS, then we'll work together, they'll conceive, then they'll see me for morning sickness, or they'll see me for different issues throughout their pregnancy, and then I'll help them towards their labor. And sometimes I'll see people with each of their children.
Sometimes in like infertility or trouble getting pregnant is unexplainable. Do you often find that there is just no reason, or do you often find after doing some investigations that someone's come to you and been like, hey, I'm not falling pregnant, can you help me out? And then you found, oh, it's actually fibroids, or it's actually, a imbalance in hormones or something like that. There's always a reason.
I think it's one of the most painful diagnoses, unexplained fertility. I think there's always an explanation. It's just whether it's ever discovered what that explanation is. There's so many different variables. If somebody has unexplained infertility, I normally send them quite quickly to go and get their hormones tested with their GP or their practitioner. But often what I'll do is check their thyroids. So they might have a basic thyroid profile done by their GP, and if they've got that, I'll have a look at it, because sometimes it's overlooked that TSH needs to be below 2 for women to conceive. So sometimes I'll spot that. Then they need to go back to their medical practitioners and get a tiny bit of levothyroxine, because the body just needs a little bit more for conception and normally for that first trimester. Something that I will also look at is what kind of folic acid women are on, and often we'll try and get them on methylfolate, which is a bit bioavailable. So some women have like a genetic SNP, which means that they can't process folic acid, which of course is added to many foods like bread these days. So they need a different kind of folic acid. And now the best prenatals will have methylfolate in rather than folic acid. So just checking what women are eating and what vitamins they're taking, and pimping all of that up can just make a big difference. And also, it happened last week actually. The woman who's just had her third miscarriage, very distressed, and is now in this country. You have to wait till you've had 3 miscarriages until you can then get medical investigations. So she's nearly 40. Her AMH is quite good. Her diet is pretty good. Her stress levels are high. So I'm looking at all of that, talking to her about how she feels about, which she was very emotional, quite rightly, about all of the miscarriages. But what had been missed was asking her about her husband. They did actually have some sperm results, but no one had got back to them. And actually, when I looked, the sperm was 1%. Morphology was 1%. It should be 4 or above. And also, most of the sperm were non-motile, so not moving. So it's really, really important to check with the women about their men, because women are so conditioned, even nowadays, to think that if they're having miscarriages or if they're having fertility issues, it must be. And maybe in this case, it is partly her age, but
we're so quick to jump to that conclusion that it's us.
Yeah, especially because they have one child. So maybe it wasn't considered that he was a problem. But of course, men's sperm changes. From what I can see, talking to her, his diet is terrible. His stress levels are extremely high. He's now got a diet to follow. I've given him vitamins as well. So hopefully we might be able to get a pregnancy there as well.
Fingers crossed for her. I hope that she does end up with another baby and no more miscarriages. Gosh, that must be terrible for her. Men think that they have like a get out of jail free card. They like to just think, oh yeah, I just have to provide the sperm and that's it. I don't need to worry about what I'm eating and what I'm drinking, how much I'm drinking. Obviously, they're like, maybe I should stop smoking because we're trying for a baby, but that's it. And it's so interesting to see men becoming more aware. And even my husband and I, we're not trying for a baby yet. I'm still like, hey, these are all the things you need to do. You should start prepping at least 3 months or 6 months before you start trying, like eating the right things and all that stuff.
Traditionally, Chinese medicine, it's considered important that women should prepare for pregnancy. So like 3 to 6 months, balance your hormones and up the quality of your food, which makes so much sense. Get more sleep, get more rest. That if somebody sees me 3 to 6 months before they wanting to conceive, even if they have no diagnosed fertility issue, that's what we try and do, because that's going to really affect the epigenetics and the genetics of that
Yeah.
child to a
Yeah.
certain extent for life and affect the next generation. I think there's a lot of research out there about the state of men's sperm, because I think it's almost 4 months it takes for sperm to completely renew. But once it's made and it's being preserved outside of the body, it's completely and utterly dependent on how many antioxidants there are in that man's blood, how much vitamin E, how much vitamin A, how much vitamin C. In other words, how much fruit and veg he eats. And also good quality protein. I think
Yeah.
you need a bit of their carnitine from fresh red meat and chicken, or from a very good protein-rich vegan or vegetarian diet, but they need their carnitine and their CoQ10. Need all of that, and they need to reduce stress, because again, it was a male patient of mine with depression who was actually having some hormone replacement therapy. He was having testosterone therapy because his testosterone was low. And one of the main causes of anxiety and depression in men is low testosterone.
Yeah.
And of course, if they have low testosterone, they then have poor sperm outcomes as well. But the women's eggs, that's more difficult to determine how diet and lifestyle can affect our eggs, because of course we're born with our eggs. But I think definitely how the ovaries and how the eggs are recruited. There's more CoQ10 receptors, the ovaries and on the eggs than in anywhere else in the body, maybe apart from the heart. We need CoQ10 is normally in lots of foods, but definitely in lots of protein. And I think that's what acupuncture can do. If we work over the ovaries, we're helping to recruit better follicles, more eggs, trying to kind of pimp them up a bit with diet and with a bit more blood flow.
Let's change gears a little bit. Let's talk about pregnancy. I'm sure quite a few people come to you asking about the safety of acupuncture. How safe is acupuncture for pregnancy?
Again, I think if you Google, you'll pull up a lot of research on it. The reason there are a bit more research done by hospitals around acupuncture in pregnancy is because it is really safe. All of the research you'll see is done by hospitals. I don't think there'd be research projects on women in pregnancy if they didn't think acupuncture was safe. In acupuncture, there are certain points that are forbidden in pregnancy. It's a very common point here on the hand we don't do. Don't work on the tops of the shoulders anymore. We definitely don't work on the abdomen anymore. And there's a point above the ankle called spleen 6, which works on the cervix, which we don't do either.
That's the one that helps induce labor, correct?
Yeah.
Yeah. Or you can press it to help contractions come on more.
Actually, it helps contractions in the lower part of the uterus. So an acupuncturist who's properly trained wouldn't use any of those points in pregnancy. But it can still be really effective because women are so responsive. So it's really good for pelvic pain, pubic symphysis pain, back pain in pregnancy. In first trimester of pregnancy, when we might be working on helping women relax, especially if they've got a history of miscarriage and they're very anxious, because that also influences how bad their morning sickness is. And there are specific traditional points that help morning sickness. I even found a really good review on how acupuncture can support hyperemesis gravida, which is obviously like really severe. Acupuncture by no means stops that level of nausea, but what it can do, and actually the study points to that, is it can just reduce the frequency of hospital visits that woman has to make.
And when there's talk of induction of labor, a lot of mums get a little bit scared, like, I don't want to be induced with Pitocin. How can acupuncture help with induction of labor?
So women who come, like you say, and they're really nervous about being induced, and they come to you, literally a few days before they're going to be induced, and they're nervous about acupuncture.
Yeah.
And they're nervous about being induced, and they're not sleeping, and they didn't sleep the night before, and they haven't had breakfast. Those are the patients that I have to be really careful with, because they just might faint.
Yeah.
And if they do, we just take the needles out quickly and lie them on their side. And so you never leave pregnant patients on their own. But so induction, there are key points that we use to help get labor going. And I always describe it as you're kind of like nudging that person forward a bit.
Oh, yeah.
It just pushes women over the edge into that cascade of labour. I always point out that acupuncture induction isn't like medical induction.
Yeah.
We're going to get that person more relaxed so that her body is able to build up more endorphins, able to send messages down to the cervix to get it ripening. I'll get her breathing as well, really deeply, get her breathing down into the perineum, just slow everything down so that the points have got more chance to work. And also just coaching them on the fact that if they do need to be induced, what are they going to do? How are they going to breathe? And teach them some birth acupuncture points that their husbands and partners can use to keep them relaxed. Because if the acupuncture induction nudges them along but not quite enough, then I don't want them, you just basically don't want them to be frightened, because that's not going to help any situation. But there's really good research and evidence out there that acupuncture induction helps women to go into labour more naturally.
Yeah, definitely.
That case is really cost effective because you're reducing that cascade of intervention that happens, the emergency C-sections and all of the complications that can ensue from that. I'm just thinking about a patient a few weeks ago. I had used acupuncture to turn her baby. She had a lot of trust in me already because she'd seen me for morning sickness relief. And then amazingly, the baby turned with acupuncture treatment about 36 weeks. But then really, unfortunately, just in the last week, she started to get itchy skin. And of course, she had cholestasis. It was really quite borderline. So she was going to then have to be induced on her due date. She was getting quite stressed about that. Her cervix, when she was examined, was not quite ready. So we were doing what we could for that, but she was getting more and more stressed. And then she just happened to mention in passing that she didn't know whether the baby had moved the night before. And of course, that alerted the medical profession. They checked, and in fact, the baby was moving plenty. But then the induction was brought forward by a few days, and I still haven't heard what happened.
Oh, no.
Hopefully
she got the birth that she wanted.
I hope so. What I do in those cases is I've got the time, maybe more time than the midwives have, to talk to her about what might happen and how she might feel and what she can do when she's there. I think it's really important as an alternative practitioner that we make sure that women are as positive as possible. And I certainly am very careful not to be negative about the medical profession. What I will say always is that, especially because women will often complain that they feel rushed or they feel on a treadmill or they don't feel that they have any personal contact, the most important thing is they are going to keep you and the baby safe, and that it's up to you and your partner to look after your own birth experience in terms of it feeling good or therapeutic. The system, unfortunately, goes against that.
Yeah, there are definitely some times when you need to be in the hospital. The main thing is that you and your baby are happy and healthy. Yeah, and learning what you can do if you do go into hospital, learning your rights and learning to be confident enough to stand up for yourself. And when it actually is an emergency, or when you can just say, no, I don't want to sign that document or such. Yeah, so really educating yourself does go a long way.
Another thing that I think is really important is that women share positive birth stories.
Yeah, definitely. Yeah. These
Modern
negative birth stories don't really help anyone, do they?
And when you are pregnant, I remember when I was pregnant myself, everybody tells you, because it's part of their trauma response to something terrible. What we need more experience of as women is to know more about giving birth and what birth is like before you get pregnant, because none of us as modern women have ever seen our mothers giving birth or our sisters giving birth.
Yeah.
And I think there's loads of good resources out there, like positive birth stories and positive birth videos of women giving birth. Because when I was in labour, that's what I remembered. It's really important that we all share our stories.
Yeah. So then there are obviously pressure points, because the partner's not going to be using needles, but there are acupressure points that the partner can use during labour to help relieve pain, help the contractions come.
It's not as strong as acupuncture. You're still, by pressing the point, you can still make a difference to what's going on, and it can be quite effective.
And as you said, doulas are a perfect source. If your partner can't get his head around it, or wants to be in a different position, holding your hand all the time, or can't get up out of the position of holding you, then the doula can step in and do the acupressure. The woman is comfortable with that. So, yeah.
And what's brilliant about acupressure is it can be done in water. So if a woman's managing to get into the bath at the birth center or at home, it can be done there. And actually, it's really great. I do coach women to teach them how to get their partners to practice. Men are really good if they've got something practical to do. For a woman, just having your partner there, you really tune into that when you're in labor. But for them, it's quite nice that they've got something practical and physical to do. So the acupressure points are brilliant. There's a fantastic midwife who's done a lot of work on acupressure points, and she's got a really good website. She's a New Zealand midwife called Deborah Betts. She's got a lot of free materials out there about the acupressure points. So I normally refer people to those, but also show them myself. I've found it easier to show the women the acupressure points for them to show to the men. So they normally go home, and sometimes I'll draw the points on so that they can work on, because the really important points for birth are actually on the sacrum. So a nice male thumb in those sacral foramen can really help a woman get through a contraction, because it really increases endorphins at the point. I will give a picture, a diagram where the points are. And also I'll do some acupressure for the woman so she knows how it feels.
Yeah.
And draw the points on so he can find them.
That's good. Make it super easy.
And the other points are easy to find. There's a point on the leg that you mentioned earlier, spleen 6. It's just above the ankle bone. And this point here, that really tight bit on a woman's shoulders, especially at the end of a pregnancy. You can also kind of put your elbows on that point and press down, and that really helps.
Those acupressure points are so helpful, and it really does make a huge difference.
When you're a very heavily pregnant woman, it's a strong thing. It's a big physical thing to give birth. You don't want somebody fiddling with you.
How can acupuncture help after the baby has arrived for the mum postpartum recovery?
Yeah, I find this the most difficult area, because it's really hard for mums to come back.
They're just in mum mode in their little bubble.
And they put their own needs maybe a bit lower down the pecking order. And also on a practical level, it can be hard to come in. But if they do come in, if we've talked about it beforehand, and sometimes it can really help with mild depression and anxiety. Some women know that they feel like that when they get sleep deprived. We set that up and maybe put some appointments in, and insomnia as well. So the kind of women who just get over exhausted and then just can't sleep or can't switch off from their baby. But also it's really important to come in if there's issues with breastfeeding, so it can help let down. There's particular points that can really help increase breast milk flow and quantity, and also to switch off the stress response if it gets overactivated, which just might be influencing blood flow. And traditionally as well, there's what they call mother warming, which is using warming herbal treatment and some needles to a certain extent to help the uterus go back. So support the fascia and the abdominal muscles to come back in. So women who have a big gap, it can help that. It can also help prolapse. So there's certain points for prolapse. I had a lot of prolapse support work from an acupuncturist when I'd given birth to my son. So yeah, that kind of thing, it's important to come sooner rather than later. And also most acupuncturists will also have a lot of resources. Even if you can't get in to see us, we would be able to give you the number of women who can come to the house to help with breastfeeding. Most of us work as a network of birth professionals.
How can listeners find your practice, book in an appointment? Where can they find you?
So my website, hannaevans.co.uk. I'm also on Instagram. I forget my Instagram handle, Hanna Evans, I think it is, something like that.
Hanna_Evans_acupuncture.
Yeah, that's the one.
I wrote it down earlier.
I'm the usual places, but if you put my name and you put Fulham, London, I'll come up and you'll be able to find me.
Amazing.
And, I would really welcome as well anyone who's abroad, if anyone wants to work via Zoom or wants a bit of email support within, I'd be really, really happy to answer any queries. But yeah, do reach out to your local acupuncturist, because many of us specialize in women's health and birth and these areas. So
definitely amazing. Hanna, it's been amazing to talk to you today. I've loved talking about all this stuff and educating other people about the amazing benefits of acupuncture and acupressure, especially around like fertility and period and pregnancy. So thank you. And I really don't think enough people know about the real benefits and uses. So yeah, thanks so much for coming on to talk to me about this today.
oh, it's a real pleasure. Thank you so much.
If you're enjoying the podcast, make sure you give us a follow and rate the show. If you know someone who you think needs to listen to this episode, give it a share so we can spread the word and educate more mamas and women worldwide. And we'll see you next Monday for another juicy episode. For more information on pregnancy, birth, and parenthood, head over to my website or Instagram at blissfulbirth.co. And just a little reminder, the information contained in this podcast is here to educate and empower and does not replace the advice of your own healthcare provider.